And people feel like when you get a diagnosis, that's the end. It's over, it's a wrap. They have Alzheimer's, they can't do anything, they're just going to be home and that's it. And that's not the case. In those early stages, my mom and I, we used to travel, we used to go out and still hang and do things that we would do even before she got the diagnosis. So I think it's important for people to understand that there still is some quality to life.
Welcome, Veronica, to Grow Healthy, Help People, the podcast that Accordus puts out, talking with nonprofit leaders around the country and around the globe. Where are you calling from this morning?
I am calling from DeSoto, Texas, which is a suburb right outside of Dallas.
Outside of Dallas. And we're talking about Dementia Care Warriors, the organization you founded. I look forward to hearing more of that story. Before we dive into the Dementia Care Warriors story, tell me a little bit of your story. What was your education and what did you start off with your first career? Was it in the nonprofit space or was it in the business space? Give me more of that story.
Sure. So originally from Dallas, went to undergrad at the University of Texas at Austin, so I'm a Longhorn. And then a year after undergrad, I moved to Chicago. And so I was in Chicago. That's where I had my early career days, was in Chicago. And I worked in marketing, branding, events. So I have a really strong background in that. Worked at an advertising agency, worked at a community college as the director of marketing. And that was kind of the extent for those 10 years of my professional career.
So
Towards the end of, go ahead, I'm sorry.
Yeah, so what drew you back towards Texas?
Is what I was about to say. Towards the end of my time in Chicago, my mom was in Dallas and she was taking care of my grandmother. She was a caregiver for my grandmother who had Alzheimer's. And so I would come back and forth to visit them. And I could kind of tell my mom was struggling to take care of my grandmother. My mom was also working full time at the time. And at some point, there was an incident and I just decided, okay, it's time for me to leave Chicago and move on to my next adventure. And honestly, I had that thought before I decided to come back to Dallas. I thought of I wanted to go to DC or Atlanta or Houston, but I knew I needed to come to Dallas first. And so I came to Dallas to help my mom take care of my grandmother. And then a year later, my mom was also diagnosed with Alzheimer's.
Okay, that is a hard story and a hard journey. So I guess that is the beginning of what got you into memory care, dementia care. I want to make sure I say the right terms. But so you first started off by just caring for your grandmother, and then now your mom.
Mm-hmm.
But also you started a nonprofit to do that at a larger scale. Tell me more about what the caregiving was like for your mom and your grandma, and then also what prompted you to then start an organization.
So the caregiving was hard. Again, I had two people at once. And just I was challenged in finding resources. Um, there is clearly, medical aid and whatnot for the actual patient, but not a lot of support for the actual caregiver. And so it's a really isolating journey when you don't have anyone around you who gets it or who understands what you're going through, or even the education to understand the disease, you know.
Yeah.
And so, because it is a disease process, it's a
Yeah.
progressive disease. So there are things you should be doing at the beginning of this journey. There are things that you would do at the end of the journey, that are
And when you
different.
say
So
do, is there any action in hopes to prolong and reduce the dementia progression, or is it more just dealing with the symptoms and loving the person and showing up for the person?
yeah, it's more with dealing with the symptoms and loving the person and showing up for the person. And for me, for my mom and my grandmother, it's always been about quality of life,
Yeah.
And people feel like when you get a diagnosis, that's the end. It's over, it's a wrap.
Yeah.
They have Alzheimer's, they can't do anything. They're just going to be home and that's it. And that's not the case. In those early stages, my mom and I, we used to travel, we used to go
Yeah.
out and still hang and do things that we would do even before she got the diagnosis. So I think it's important for people to understand that there still is some quality to life even
Hmm.
with a diagnosis.
Yeah. And tell me about your mom and your grandma today. Are they with us still, or are they gone?
So my grandmother passed in 2017, and so
Okay.
it's just been my mom and I since then. And so
Yeah.
I'm still a full-time caregiver for my mom. She's actually here
Okay.
now with me. And it is 24/7, a 24/7 job. She's in the later stages now. She's actually on home hospice
Okay.
care, which we've been on for some months now, but which is another resource that we teach
Yeah.
people about because people don't
Sure.
know what hospice is or when to call them. But yeah, that's where we are now. It's just my mom and I.
Well, that's a hard journey. Sometimes on these calls with nonprofit leaders, the end of the story is like a big uptick, and then these
Hmm.
great things happen. But unfortunately, in the area of service that you are providing services to your family than others to the organization, there's
Hmm.
a hard outcome at the end of every one of those roads, I guess.
Hmm.
Right? Yeah. So
There's
tell me more about Dementia Care Warriors, and so what prompted you to start the organization, and what are the programs you run now? What do you do today?
Sure. So what prompted me to start the organization after my grandmother passed and it was just my mom and I originally, even before that, I was on the board of the Alzheimer's Association, our local chapter of the Alzheimer's Association.
Okay.
I was doing like education and speaking, and I got involved with the Alzheimer's Association because I was looking for resources. And so I started volunteering with them, and just eventually I started learning about a lot of resources that the
Uh,
caregivers in my community didn't know about, even outside of the Alzheimer's Association. And so I found
you're kind
a
of becoming an expert in the resources that are out there.
right, exactly, 100%.
Okay.
And so I'm like, people need to know about these things. That was one thing. Another thing was just the community and the lack of community for dementia family caregivers. And so I ended up partnering with the Alzheimer's Association before I even had DCW to host an African American caregiver conference at my church.
Okay.
And then around that time, I also started doing support group happy hours. And so the support groups that I had been to and I had even facilitated were all very sad and very down, you know. And this is a sad topic, but we live in some of us or some caregivers live in, sad situations. So I'm like, let's go out and like laugh and have a good time. And at least it just this one day of the month you have to come be around some other
Something to
people.
look forward to with people that
Yeah,
understand what you're going through.
exactly. So at least you have that at least one day a month to look forward to. So started with support group happy hours,
Yeah.
and then between those two events, and eventually came into DCW and started the nonprofit to expand.
Yeah.
The
And
other
what
thing
year
was
what year did you found Dementia Care Warriors?
2019.
19. Okay.
Yeah. And then the other thing was I wanted to host a caregiver conference myself
Okay.
because the caregiver conferences that I've been to in the past and the workshops, again, were not, they were, a lot of times it's just someone coming and talking at you and no. So I was said I'm going to host something that is going to be a fun, full day, and it's going to have engagement, and you can feel the
Yeah.
love and the joy, and the staff is loving on the caregivers, and
Yeah.
I'll live DJ, have a catered brunch, not box lunches, but a catered brunch. Have whatever bells and whistles we can find to pour into these caregivers and make them feel like rock stars for the day. And
Love it.
so that is how we launched Revive Refresh, which now is 2020. And the first Revive Refresh was scheduled for March 14th.
Oh goodness.
Did not happen,
Uh-huh.
sadly. We ended up doing it virtually for 2 years in a row. And then finally in 2022, we had our first in person. And so now we're actually about to do our seventh Revive Refresh this year in August.
How neat. Good for you.
Thank you.
Um, so you founded a nonprofit. Every nonprofit starts small. Not many of them start off with a $5 million grant. But you're starting off and you're cash flowing this thing and a few people are giving money here or there and you're probably the primary donor to start off. Tell me more about what it felt like starting a nonprofit on your own and getting it off the ground and maybe those first few steps.
So the interesting thing about my situation is I really was not bankrolling the nonprofit because I
Okay.
was, let's be frank, an unemployed caregiver. You know,
Yeah. Yeah.
um, I because I had been in this industry and
Uh-huh.
because I was already an advocate, I had contacts and network and whatnot. So I started off with partners
Okay.
who were looking to partner with me for that first Revive Refresh. There's a local adult day center was our venue. And so it was a place that my mom and my grandmother had gone for care. And so I knew the owner there. We always at Revive Refresh, we have a vendor resource area. So then I had different
So sponsors
organizations.
and vendors.
Yeah.
Yeah.
Different organizations and sponsors come in and have tables. Speakers. I was able to tap my network. I had some amazing friends in my network who were doctors or
Mm.
attorneys or, who were able to come out and speak and donate their time doing that. So a lot of the things that we were doing, I was able to do based on just my relationships and partnerships.
Yeah, that's great. And so today you're running, is it primarily the events? You mentioned a few different events that you run consistently every year, right?
Right. So we have the events, but then we also do community education.
Okay, tell me more
So
about
we
that.
are so we are out in the community. We go to churches, nonprofits, support groups, even professionals. So even to senior care facilities to train staff and things like that. So we do education. We're trained to do a simulation called Dementia Live, which puts people into the shoes of a person living with Alzheimer's and dementia. So we're certified to offer that. We take that out in the community. We also have a respite scholarship program where we partner with a home health company to provide a break for a day for caregivers. So it's an 8 hour break and a professional caregiver because a professional caregiver is $30 an hour, $35 an hour. If you want to go out to dinner, you hire a professional caregiver through an agency, you're tacking on another $100 for care, to that, which again, a lot of caregivers have left their jobs. A lot of people are on fixed incomes. People don't have the money to pay for a caregiver to come in. So that's a way that financially we try to help out with that. So we do the community education, we do the respite scholarships, we do Revive Refresh, which is the annual event that I mentioned. And other education events. We just did an event in February called Caregiving with Confidence, where we partnered with a church and another agency to bring together a day of education for caregivers.
Hmm.
Oh, one of the biggest things we just launched is an online community for caregivers.
Okay.
Almost forgot to tell you
What do
that.
you call that?
Care Warrior Connect.
Okay.
Care Warrior Connect. So what happens is I'm in Dallas. Clearly, I am a team of very few. And I get
Yeah.
calls from people outside of Dallas who are asking for resources and asking do you know of anything in Nashville, for
Yeah.
caregivers, which I don't. But now, for those people who are reaching out outside of Dallas, we now
Hmm.
have this online community where anyone can come into this online community. It has a virtual support group. So for
Okay.
those caregivers who can't get out to make it to our in-person support group, we have a virtual support group,
Which I imagine would be pretty
webinars that
hard to be able, because you'd have to hire somebody to come care for the
right.
person suffering with dementia to then go to the care group. So it's kind of like
Yeah.
being able to do that virtually is great.
Yeah. And then it's of course also education and webinars and
Yeah.
those sorts of things to help on the
Yeah.
journey.
So how are you raising funds today? What is the primary source of revenue today?
The primary source of revenue is probably a combination of sponsorships and grants.
And you're hustling. Are you one of a few staff members? Or are you one of one staff member?
I'm one of me plus a project coordinator who's 10 hours a week.
That's great.
Um, and then as needed, I'll bring in contract employees. So
Yeah.
there's
Yeah.
that.
Yeah. And so, Veronica, as you're leading a small nonprofit, you have all the feelings of got to get these donation receipts out and got to get the website updated and got to get the donor management system running the right way. There's a lot of moving pieces, and even paying your contractors. You're like, just to pay a contractor, now we got to start, is it a contract? Is it a W-2? How's it going to work? What is the
Hmm.
right payroll amounts? As you're doing that, and as anyone watching this podcast is doing the same thing Veronica's doing, Accordis, our company, we're a back office for nonprofits, and we say, give us all that work to do so you can go lead. So Veronica, if you or anyone watching this podcast is interested, I'll put our website, accordis.com, at the end of this podcast. And Veronica, is the best website for Dementia Care Warriors, is it dementiacarewarriors.org or I'm a carewarrior.org? Which one's best?
Go to iamacarewarrior.org.
That's
DementiaCareWarriors.org will send you to iamacarewarrior.org, but
yeah.
the concrete spot is
That's the
iamacarewarrior.org.
forever spot. I'm a
Yeah.
carewarrior.org. And that's where people can learn more about how to get involved. If someone did want to get involved or has someone they're caring for that has dementia, what's the best next step?
First of all, make sure you have a diagnosis. Go to the doctor, get a diagnosis, make sure you know what type of dementia they have. because that's important. And then start looking for a support group. Start looking for a support group, whether it's virtual, whether it's, online. Find your village, in this journey, because you really can't do this alone.
Yeah. And you and others, but others taught you a lot, then you learned a lot. Someone who receives a diagnosis is a hard place to start, just with a pen and paper writing notes down as you're hearing things. So you could go to Veronica and Dementia Care Warriors and learn a whole lot there, a whole lot faster than having to just rebuild the engine yourself. So the work you're doing, Veronica, matters. I'm sorry that's a really hard journey, but I'm glad you're saying, let's not just do this for me and my family. Let's do this for others and help them, support them, be there for them as they're caring for their family members.
Absolutely. Yes.
You're doing great work. Keep it up. Have a great day.
Thank you so much.
Blessings.